Every patient visit to the GP surgery in England provides a potential data goldmine, and one the government is keen to make use of.
The NHS uses your patient data to support planning and research.
Medical history is used for research, analysis and, according to NHS Digital, improve health and care services. Patient records uploaded onto a central database. Scotland and Wales have their own patient data collection systems, but in England, well, the history of these schemes has been, quite frankly, checkered. Care.data back in 2014 eventually had to be scrapped because of concerns over transparency, privacy and safety. Now the latest system has been delayed from July the 1st to September the 1st, precisely because of the same concerns. The care.data consultations in 2014 did involve a massive leaflet drop to households, but it failed to assuage doctors and the public's concerns.
Intelligent data also drives the tools we create.
This time, the scheme known as General Practice Data for Planning and Research, or GDPDR, had so little fanfare, many GPs and certainly many patients didn't know it was happening.
They aren't being clear to patients, they're not being transparent to patients. People can't find out how their data is being used. And yet, they make this big claim for anonymisation. What's actually going on is they're using pseudonyms. Well, because they're using pseudonyms, they could tell every patient how their data had been used. And the one lesson they seem to have learned from care.data is if you want to do something like this, sneak it out.
More information will be included in the data this time, such as HIV status or domestic abuse. No names and addresses, but encoded postcodes will be included. Patients can opt out of the scheme by printing out a form and taking it to their surgery. However, doctors' leaders wrote to NHS Digital over the lack of communication with the public, and today the Health Minister conceded more needed to be done.
Data saves lives. It's as simple as that. We've seen that in the pandemic, it's one of the lessons of the vaccine rollout. The GP data programme will strengthen this system and save lives. And patient data is, of course, owned by the patient. And we are absolutely determined to take people with us on this journey. We have therefore decided we will proceed with the important programme, but we will take some extra time.
By harnessing data,
but those concerned about this latest scheme are now asking why the government tried to push it through so quietly and so quickly.
Well, I'm joined now from Edinburgh by Professor Cathy Sudlow, Director of the British Heart Foundation Data Science Centre, and by Corey Crider, who's Director of Foxglove, a team of lawyers and tech experts campaigning to protect our personal data from government and commercial misuse. Professor Cathy Sudlow first. When you look at the scale of the data that's going to be collected, it does dwarf anything that's been done so far, doesn't it?
NHS Digital already collect a huge amount of data from various parts of the NHS, including data from general practices. So what they're essentially doing is making the processes that they currently run better, more efficient and more cost effective, so that we have better care, treatment and outcomes for everybody at lower cost than currently.
Corey Crider, put like that, it sounds rather good, doesn't it?
Certainly planning and research data uses sound fantastic to us, but there was a lot of fine print on the NHS Digital website that was left out of that answer, I'm afraid. So one of the things that they have said, and we're trying to get more information out of the government about, is that some companies would be permitted to access the data. What we've basically been saying is, and the pandemic teaches this, there's no public health without public trust, and you can't just suddenly pool the entire cradle-to-grave health record of all 55 million people in England without explaining to people exactly what you're doing, what choices they have, and on what terms things like pharmaceutical companies or tech companies are going to be able to access the data.
I'll come back to let me just put that point about the companies, because Professor Sudlow, that is a concern, isn't it, that commercial companies have access to some of this data?
Yeah, so I think it's important for me to state that I'm speaking on behalf of the medical research community, and in particular Health Data Research UK this evening, and also as a doctor who looks after patients with stroke in the NHS. But I think it's important to say that there are very robust safeguards in place to ensure the privacy and the security of all data that's provided through NHS Digital, and it's only ever provided or shared when there are legitimate purposes and when it's very clearly in the public benefit. And the bar is set particularly high where it's being shared with any companies.
Corey Crider, and those safeguards, for example, they won't collect entire GP records, patients won't be identified, there'll be independent oversight, patients would be able to opt out. There's a whole raft of safeguards, aren't there?
There are the beginnings of some safeguards, but there are quite a lot of holes in it as well. It's looking a little bit at the minute like a piece of Emmental. We would really like to get to a place where the government can use health data for planning and to support the NHS. We all want to see the NHS come out of the pandemic stronger, but patient jury after study shows that when you ask people if they're comfortable, for example, with having their data available to commercial companies for private research, that actually a lot of people aren't comfortable with that.
So what holes do you want filled then in that Emmental?
What are the concerns? So we don't know, for example, what the terms are of access for private companies. They talk about an independent review panel, but we don't know what the terms of reference are exactly for it or how it's going to relate to the new scheme. There are a whole bunch of questions as well about why it has to be pooled. And by the way, I welcome what appeared to be a concession today in the House of Commons because they said that they are going to look at putting it all in a trusted research environment. But the real question, I think that if they're going to take people with them, they need to answer, well, who's going to be trusted into the research environment? Those are still basic questions. And if people are concerned about it, it's important to remember that you can opt back in, but if you want to opt out now until the questions are answered, you can look up Med Confidential how to opt out, and you can opt out and just wait till the government explains. You can also follow along on Foxglove's website for updates on the case.
Professor
But yes,
Sudlow,
research is great.
Professor Sudlow, the government says it wants to take the public with it. Can it? Or is there a scale of opposition now that is hard to overcome?
No, I don't think so. I think most people are very aware, particularly at the moment, about how important it is that data from the NHS is available to be used for planning of healthcare and for research that makes discoveries, for example, about treatments that will benefit people who have COVID-19, about the safety and the effectiveness of vaccines for COVID-19, and about long COVID, about a condition about which we really know very little. And without access to researchers and others with legitimate interests to help the public, we'll never understand and properly be able to provide care for patients with these conditions.
Corey Crider, you don't want the whole thing scrapped. You are prepared to acknowledge there are some benefits of the kind that Professor Sudlow has just set out.
Absolutely so. But patients make the NHS and fund the NHS, and it should be patients' choice. One of the things that the National Pensioners Convention was saying, and why they came along with us on this case, is there are millions of older people in the UK who aren't online and will have had no idea that this is happening. The last time, the government at least sent a leaflet under everybody's door with an explanation, so people who don't, let's say, go to the NHS digital website could find out about it, and they haven't even done that this time. So there is a need to slow down, explain to people where they're going, and let people make an informed choice about who they want to access their health record. It is their information.
Professor Sudlow, you'd agree with that?
I think transparency is really important. And of course, it's important that people are aware of what's going on and can opt out if they don't want to be part of it. But it's also
And they haven't been made aware of that so far?
Well, I think, I think people have been made aware of this. There's probably more conversation that can occur, but we shouldn't delay this too long because data saves lives, and therefore lack of data means that people are dying because the data are not being made available for legitimate and important public benefit purposes.
Professor Cathy Sudlow and Corey Crider, thank you both very much indeed.